Hello YouTube, this is my pregnancy experience breastfeeding. And I decided to do a video on breastfeeding because I know that this is 2009 and not every, especially women, young women don't breastfeed. It's a lot easier to do formula. So I wanted to do a video on my experience with breastfeeding, and I could say that I started breastfeeding right away. A lot of different problems may occur when you're breastfeeding, and I think the biggest problem is that you don't breastfeed your child right away. And when you're breastfeeding, you can't introduce the bottle to a baby until they're at least 4 weeks old. 4 weeks. And if you do that, they learn to suck the bottle, which is a lot easier than sucking the breast. So they don't want to feed on the breast. So it's kind of like when they're first born, they have that natural instinct to want to breastfeed. So you might see them start doing something like this on their hands, and that's like them telling you that they're wanting to feed. And you want to try to feed them right away. So if you're in the hospital, you want to tell them not to give your baby a bottle, and you're going to have to breastfeed them. And you're going to have to breastfeed every 2 to 3 hours. You don't want to go past 3 hours when you're breastfeeding, because especially in the beginning, it will affect your milk supply. The more your baby feeds, the more your baby feeds, the more milk that your body will produce. If you're not feeding your body does not produce milk. And I know a lot of women have that problem where they're not producing enough milk. So you want to try at least every 2 hours with breastfeeding. Why should you breastfeed? My biggest reason, and I know this is my vain side coming out, breastfeeding helps you lose weight. So, in those dark nights when I wanted to give up because I'm tired of having to feed a baby every 2 hours, and it's so much easier to just throw some cereal in that bottle or just give them some formula and have the daddy do it. And but no, it helps you lose weight. But besides that, it helps you with postpartum depression. And I can account to this because I know they say it's called oxytocin, or I think it's called oxytocin. I'm really not good with those kind of names, but there's a chemical that is released when you're breastfeeding, and it's kind of like a happy drug. It makes you feel happy, and that I know that feeling because like when I was breastfeeding, especially in the very beginning, it happened more so than now, and I'm 6 weeks postpartum. It happened more then. I would just be like, oh, kind of like I was doped up a little bit, and that helps with postpartum. It helps you lose weight. The when you're pregnant, you have a calcium deficiency because the baby's taking up so much calcium. Some women even lose their teeth because when they're pregnant, and they have bleeding gums and all of that because of the lack of calcium. It puts calcium back in your body. It also causes your uterus to contract. This is all the pros for you, not the baby. It causes your uterus to contract, which helps you not have postpartum bleeding, which is the main cause of death related to pregnancy. It's not during labor, it's afterwards when you're bleeding and bleeding and the bleeding doesn't stop. Because remember your uterus is at the bottom, it's way in the bottom of your vagina, that area. And it moves up during pregnancy, and it's up there, and it needs to contract back down. And breastfeeding actually helps that. Even while you're breastfeeding, especially in the beginning, you'll feel that contract. You'll actually have many contractions while you're breastfeeding, so you can feel your uterus going back down, back down, back down, back into it's in the spot that it needs to be in. So that helps, and it actually helped me because when I gave birth, and I actually had an ultrasound after I gave birth. I gave birth to the placenta, and my midwife did an ultrasound on me. They had the ultrasound technician come in and to see if I had any placenta, and it wasn't showing on the ultrasound screen, but I still had placenta left up in the in the canal, which I didn't know. My midwife checked; she didn't know. No one knew. And because of the breastfeeding and the contracting, it made it come back. And the bad thing with leaving placenta is you can get an infection, and infections can cause, like, you get a really, really bad infection, and that can lead to death as well. So because of me breastfeeding and my uterus contracting, it forced it wasn't a huge piece, because the placenta is huge. It was like, I mean, it was a big, but it wasn't as big as the placenta. It was like a nice sized piece that was still left inside, and it helped it come back out. And I was home. I was home when that happened. So I actually took it back to find out what was going on. So breastfeeding is, it also helps. They say that later on in life they did studies saying that it's helped women. You're less likely to have breast cancer if you breastfeed, and they've been doing studies on that now to help your baby. And my baby was jaundiced when he was born, so you can see he was yellow. He was born, and a couple days later they have something called belly rubin that breaks down in their system, and it causes their skin to be yellow. And if it's too much, it causes like brain damage. And you could see, like, when I would breastfeed him and he goes to the bathroom, the poop was actually yellow, and it still is yellow. But his eyes turned back white now, and he's better now. But he was jaundiced in the beginning, and that helped him. And also, it coats their little stomach, like the antibiotic. You have antibiotics. The first, when you're first breastfeeding, you have colostrum, which is not actual milk. It actually is like, it coats the baby's stomach. You also are giving the baby antibiotics, so they're not as sick as much. Like breastfed babies are not as sick as much, and it just does so much. And it's just like, also it helps with like gassiness and fussiness, and a colicky baby. Some babies are colicky, and it may be because of the milk they're taking. And this milk is like natural, and it's everything that your baby needs. And the colostrum and all the antibiotics and all the different properties of the breast milk that they can't duplicate in formula milk. So if you can breastfeed, go ahead. And I'm gonna say it's not easy. Every couple you have to get used to, being on it every couple hours. Like, my baby's sleeping right now, and so I know it's gonna be time for him to eat pretty soon. Getting used to that, and just getting, the sore breast. You have your breast being sore is the main cause of people stop breastfeeding. If you want to breastfeed, this right here helps. Get this before you even have the baby. And they actually have instructions on it, which I didn't know until after the fact, that you're supposed to put this on before you have the baby to kind of soften those nipples up. Also, now, for the first 10 days, it's going to hurt, okay? It's going to hurt. I'm not going to lie to you. It's painful. It's not labor painful. So if you went through labor, you can do breastfeeding. But it's not labor painful. You can do it. Just make it through. Now, if you're still having pain, and I would say do this anyway, check with a lactation specialist, okay, at your hospital, someone who's done this before. Let them watch you feed to see how you're feeding and see what you're doing wrong. Me, myself, I have big breasts. They got to a size F during pregnancy. And, when you have your baby, you have to support that breast. And, you have your C hold. It's kind of hard to show you on YouTube, but you have your, you want to have your hand in the C and have your baby here, or have your baby here with your C hold, and you want to support it when it's going to the mouth. That was a mistake I was making when my lactation specialist caught me, because I was just letting my breast hang, and he's tugging on it, and it was awful. But this helps with cracking. Also, when you're getting in a tub, it hurts when I take showers because the nipple is sensitive. Put it on there. You want to keep it. You want to put that on much, like after every feeding, especially in the beginning. Now I don't have to use it at all. But that first couple weeks is gonna hurt, and if it's still hurting a whole lot, you probably have bad technique. And if you're not producing enough milk, no, right now, if you're not feeding your baby every 2 to 3 hours, you're going to dry up. You're not going to have enough milk, and you're not going to be able to breastfeed. So if you're not feeding your baby, and it's hard to wake, when he was little, it was hard to wake him up when he was that young. You're going to have to be proactive, okay? Every couple hours, wake him up. If you have to take off all his clothes, put a cold rag on him, put ice on his feet, whatever you have to do, you have to be feeding him every 2 to 3 hours. And they will sleep literally all day, especially in the beginning. They won't wake up for nothing. And then, once you get them in that routine, they'll start waking up. Like, he wakes up. I don't have to wake him up anymore. He wakes me up, okay? But in the beginning, they'll sleep, and then and then as a tired mom, you'll let them sleep, and then you don't have any milk, and you can't breastfeed. So that's my breastfeeding experience. And if you have any questions, go ahead and YouTube me. Love you guys.